understanding the pelvic floor during pregnancy.
The pelvic floor is a group of muscles supporting the bladder, uterus, and bowel. During pregnancy, these muscles endure extra pressure and stretching, which can lead to issues like incontinence or discomfort. Maintaining pelvic floor health through targeted exercises can help prevent complications, promote easier delivery, and assist with postpartum recovery.
Why pelvic floor exercises matter.
Pelvic floor exercises, often called Kegels, strengthen the muscles that support your pelvic organs. Regular practice can reduce the risk of leaking urine, support your growing baby, and boost overall core stability. Keeping these muscles strong before and after birth helps your body recover more quickly and may prevent future problems.
How to do a basic Kegel exercise.
To perform a Kegel exercise, first identify your pelvic floor muscles. Try stopping your urine mid-flow to feel them engage. Once identified, contract these muscles for about 3 to 5 seconds. Then, relax for the same amount of time. Aim for 3 sets of 10 repetitions each day. Avoid holding your breath and keep stomach, thigh, and buttock muscles relaxed.
Important tips for safe exercise.
Always consult your healthcare provider before starting any new exercise routine during or after pregnancy. Incorporate pelvic floor exercises into your daily habits, but do not overwork the muscles. Listen to your body and stop if you experience pain or discomfort. Combine pelvic floor exercises with gentle activities such as walking or prenatal yoga for best results.
Postpartum recovery and beyond.
After giving birth, continue pelvic floor exercises to aid healing and restore muscle function. Recovery varies, so begin gently and increase intensity as approved by your provider. Strong pelvic floor muscles not only help with postpartum recovery, but also improve overall quality of life, bladder control, and core strength long-term.